afternoon, respected teachers, friends, and my dear friends. I am here to present my paper on the topic a randomized controlled trial of ultrasound-guided transmuscular versus intramuscular quadratus lumborum block for postoperative analgesia in patients undergoing elective lower segment cesarean sections. Coming to introduction, in the year 2007, Dr. Rafael Blanco came up with an idea to modify the TAP block, and he described quadratus lumborum block for the first time. It is an interfacial plane block in which the analgesia is achieved in the dermatomes T7 to L1. It is a novel technique in providing postoperative analgesia following upper and lower abdominal surgeries. Till date, there have been 4 quadratus lumborum block which has been described. We chose quadratus lumborum type 3 to compare it with type 4 because type 3 has been proven to be the best. But type 4 requires a very lower skill set because it is just an intramuscular injection. So we wanted to compare whether these two blocks are efficacious, equally and safe for postoperative pain management. Aims and objectives to measure the time to first rescue analgesia and to evaluate the total dosage of opioid analgesia required over a period of 24 hours, to compare the number of patients requiring rescue analgesia over 24 hours, and to evaluate for any side effects. My study design is randomized double-blinded controlled study. Double-blinded study in the setting of Regional Institute of Medical Sciences, Imphal. The study population was pregnant women undergoing elective lower segment cesarean section under spinal anesthesia, and it has been approved by the Research Ethics Board, RIMS Imphal. These are my exclusion and inclusion criteria, and we have calculated a sample size of 100 by using the formula of comparison of two proportions with the study conducted by Mustafa M. Hussain. Method of randomization, a computer-generated randomization chart was used, and patients were divided into two groups, namely TQLB, that is the transmuscular quadratus lumborum block, and IQLB, which is intramuscular quadratus lumborum block. The block was administered by an experienced consultant, and the principal investigator, that is me, who was blinded to the group allocation, did the follow-up postoperatively. Group 1 and Group 2 both received equal volume, same drug, equal concentration of the drug. The only difference was the point of injection. The point of injection in type 3 intramuscular block was here, which is between the quadratus lumborum and the psoas major. That is outside the quadratus lumborum. And in type 4, we injected inside the quadratus lumborum block. After we received the patient in the operation theater, the basic hemodynamic parameters were noted, consent was sought, and they were preloaded with Ringer's lactate 10 ml per kg over 30 minutes. The usual routine procedure was conducted, and then postoperatively we transferred the patient to the procedure room where the block was conducted. And then for first 12 hours, the VAS scores were noted 2 hourly for the first 12 hours and then 4 hourly for the next 12 hours. This is the picture which shows the drug here, that is the type 3 quadratus lumborum block, and one is inside, which is the type 4. And the positioning of the patient was lateral to the side of the block, kept towards the upper side. This is the VAS score that we used. Results and analysis. Both the the patients were comparable in terms of age, height, weight, and BMI, and hence comparable, and it won't affect the outcome of the study. Number of rescue analgesia needed in 24 hours. In intramuscular quadratus lumborum block, 12 patients required 2 doses of rescue analgesia, whereas in transmuscular group, only 5 patients required the double doses of rescue analgesia. Time to first rescue analgesia, as we can see here, that in IQLB group, 717 minutes was achieved, whereas in transmuscular group, we achieved almost 965 minutes. That gives us an added advantage of almost 2 hours, that is 3.5 hours. These are the pain VAS scores. We can see here that at 360th minute, 600 minutes, 720 minutes, and 960 minutes, the difference was significant. At all other intervals, the difference was non-significant. At all intervals, the VAS score was lower in the transmuscular group, and except at 960th minute. This is due to the earlier requirement of rescue analgesia in the intramuscular group. There were no side effects found in either of the groups, suggesting both the groups were safe in pain management of patients undergoing lower segment cesarean sections. Lower segment cesarean section, as we all know, it is one of the commonest surgeries in the world, and management of postoperative pain is a necessity for better recovery, patient satisfaction, better bonding between the mother and the baby, and there are various advantages of quadratus lumborum block. It is safe, it is simple, cost-effective, easy technique. It provides prolonged anesthesia. It helps us in reducing the requirement of postoperative narcotic supplements, And since local anesthetics do not hamper the respiratory and cardiovascular parameters in allowed dosages, so in my study, we did not encounter any problems with the respiratory or hemodynamic changes. In view of these advantages, this study has been undertaken in RIMS Imphal, and there are no other studies done to compare these two subtypes of quadratus lumborum block to our knowledge, except that one study was done by Mustafa M. Hussain. It was conducted in pediatric population. And he also concluded that the transmuscular quadratus lumborum block is more efficacious than the intramuscular, which is similar to our study. But there are no other studies done which we can use to compare our results. The limitations and future directions, the dermatomal spread of analgesia was not recorded, and lack of consideration of socioeconomic status, lack of inclusion of emergency cases, and in future this study can be reproduced in patients with ASA 3 or 4 category, or this study can be done comparing transmuscular versus intramuscular with adjuvants, so that we can have a comparable time of rescue analgesia or even round the clock 24 hours pain-free period. Conclusion, the transmuscular quadratus lumborum blocks provide longer duration of analgesia, reduced post-operative visual analytic scale scores, and reduced requirement of narcotic supplements. However, the ease of block performance was better in IQLB as it is an intramuscular injection, which we have been practicing for so long. So these are my references, and thank you so much. Thank you so much, Medical Society.